16-year-old girl came for ultrasound abdomen due to amenorrhea. You can see the transabdominal images, what are all the findings, and give the complete diagnosis if possible. The first ultrasound image is the mid-sagittal suprapubic region. The second image is the right and left sides of the suprapubic region in oblique fashion. The third image is the coronal section of the left lumbar region. The fourth image is the transverse view of the suprapubic region. If you want more time, please pause the video and review again. Within few seconds, I will give you the findings and shall discuss about the observations. Are you ready? Let's go. Again, I have to re-emphasize the clinical history. She is a 16-year-old girl with amenorrhea. Now we will go through the transabdominal ultrasound images of her. For her, uterus is not recognized for her age except a thin bud with thin line extending downwards. You can see the arrowhead for the bud. However, both the ovaries are well visualized. You can see a small follicle in the left ovary. Only the left kidney is given and the right kidney was not seen in right renal fossa or anywhere in the abdomen. That's why there is compensatory bulkiness or hyperplasia of the left kidney, which almost measures 11.5 into 5 centimeters. Now you can see the bladder. You can see the arrow in the bladder which indicates the presence of left UV junction. Now the sonographic findings are indicative of non-visualization of uterus proper and non-visualization of the right kidney. The final diagnosis is type 2 Mayer-Rokitansky-Kuster-Hauser syndrome, MRKH. Type 2 Mayer-Rokitansky-Kuster-Hauser syndrome. First, we will discuss about the primary amenorrhea first, which is defined as absence of menarche after 14 years of age in a phenotypically female gender. I am excluding the constitutional delay of puberty, where we can have normal uterus and ovaries on ultrasound with normal hormonal analysis for this age. Usually they become normal after 16 years after the usual menarche. Here I will discuss about the three groups of ultrasound findings which could be encountered in such scenario. First one, I call it as pseudo-amenorrhea, means there is not amenorrhea, it is pseudo-amenorrhea. Either due to more common group in this decade, I'll say more common group in this decade, yes, you are right, due to polycystic ovary syndrome, where we will see normal uterus and bulky polycystic ovaries. Or second one, due to primary hematocolpometria, painful amenorrheic pattern. The example is very common one is imperforate hymen, and which will give the hematocolpometria. Other causes are also there. We have finished the first one, pseudo-amenorrhea, where we'll have polycystic ovary syndrome and hematocolpometria. Now we'll go to the second one, where we'll have primary amenorrhea with somewhat visualization of uterus and ovaries in ultrasound or MRI. So here the first one, more common one, is hormonal insufficiency, where infantile uterus and small ovaries could be visualized. Example is in hypothyroidism, uterus and ovaries will be well visualized. And the second one is gonadotrophin releasing hormone deficiency, GnRH deficiency will do that. So they're the more common ones. So of primary amenorrhea. The second one is due to aneuploidy. Most common one is Turner syndrome, which gives infantile uterus and strict ovaries in ultrasound or MRI. So we have finished the second one. So primary amenorrhea due to hormonal insufficiency or due to aneuploidy. Now we'll go to the third one. Here the primary amenorrhea with non-visualization of uterus. I will give two common syndromes in this group, either Mayer-Rokitansky-Kuster-Hauser syndrome, MRKH, or congenital androgen insufficiency syndrome, abbreviated as CAIS. So what are the differences between MRKH and CAIS? MRKH is phenotypically and genotypically female, means female it will be, and XX. Uterus will be remnant or absent and ovaries will be well seen. So that is MRKH. Whereas in congenital androgen insufficiency syndrome, the phenotypically it will be a female type, whereas genotypically it will be a male type, XY will be there. So no uterus, no ovaries could be detected on ultrasound or in MRI. So now we will discuss about the types of MRKH syndrome. So there are two types. So first type is congenital absence or hypoplasia of uterus, cervix and upper vagina due to Mullerian duct anomalies. And what is this? Type 2 is type 1 plus added renal or vertebral or cardiac or sometimes external ear anomalies. But most common one is renal anomalies, where you can have renal agenesis or renal fusion or renal ectopia. Unilateral renal agenesis is more common, as in this case where the right kidney is not seen, right? So if you have not gone through the previous quiz with a clinical history of painful amenorrhea in a teenage girl, you can go through it if you're interested. I'm giving the video link here. You can click it and go through it. Okay, that's right. That's the end of the session. Thank you very much for your patient hearing. Please share this with your doctor groups. Your valuable comments are welcome and I'm waiting for your suggestions. Thank you again.